When a patient arrives at the front desk and inquires about the cost of a procedure, what is the most appropriate action the CMAA should take? A. Refer the patient directly to the billing department. B. Provide the exact amount from the provider's fee schedule. C. Give an estimate and inform the patient about insurance coverage variation. D. Refuse to answer and tell the patient to ask during the visit. Answer: C. CMAAs can provide cost estimates and explain that actual charges may depend on the provider and insurance policies. Full transparency with disclaimers is essential. Which of the following actions demonstrates a CMAA's compliance with HIPAA regulations when releasing patient information? A. Providing information over the phone without verification. B. Faxing a patient's chart to any hospital department. C. Sending medical records with written consent only. D. Emailing records without encryption. Answer: C. Patient information can only be disclosed with proper written authorization, except in specific legal or medical emergencies, in compliance with HIPAA. A CMAA receives a call from a patient who is experiencing chest pain. What is the most appropriate action the assistant should take? A. Schedule an appointment for later in the day. B. Ask the patient to call back when the physician is free. C. Instruct the patient to hang up and call 911 immediately. D. Offer over-the-phone medical advice. Answer: C. Chest pain may indicate a life-threatening condition. The CMAA must instruct the patient to call 911 and not attempt to triage or offer medical advice. When preparing a patient's medical chart for a new visit, which of the following is the first step the CMAA should take? A. Verify the provider's credentials. B. Confirm the patient's insurance and identification. C. Review lab results. D. Fill out a diagnosis form. Answer: B. Verifying patient identity and insurance ensures accurate billing and prevents errors in medical documentation and care delivery. A CMAA notices that a patient's insurance plan has expired. What should the assistant do first? A. Cancel the appointment immediately. B. Notify the billing department. C. Ask the patient for updated insurance information. D. Proceed with the appointment. Answer: C. Before taking any further action, the CMAA should attempt to update the patient's insurance information to determine coverage eligibility. A patient who is legally deaf comes in for an appointment. What action should the CMAA take to ensure effective communication? A. Speak louder. B. Use a certified sign language interpreter. C. Write instructions in cursive. D. Have a family member translate. Answer: B. To ensure accurate and legal communication, the CMAA must use a certified interpreter, especially for critical healthcare interactions. A provider's schedule has become overbooked. What is the most appropriate action for the CMAA to take? A. Double book the remaining slots. B. Tell patients to come in tomorrow. C. Prioritize patients based on urgency and contact others for rescheduling. D. Cancel all appointments. Answer: C. When overbooked, the CMAA should prioritize based on medical urgency and reschedule non-urgent visits in coordination with clinical staff. Which of the following is the most appropriate method for a CMAA to remind a patient of a scheduled annual physical exam? A. Send a postcard with appointment information. B. Make a follow-up call a month later. C. Email the provider's availability. D. File the appointment and wait for the patient to remember. Answer: A. A written reminder, such as a postcard, is an effective and documented way to ensure patient compliance and reduce no-shows. What should a CMAA do when encountering a patient with limited English proficiency? A. Use a professional medical interpreter. B. Ask another patient in the waiting room to help. C. Speak slowly and loudly. D. Hand over printed materials only. Answer A. Only certified medical interpreters should be used to prevent miscommunication and ensure legal and ethical compliance with patient care. A patient calls to request test results. The CMAA checks and sees that the results are in the chart but not reviewed by the provider. What should be done? A. Fax the results to the patient. B. Read the results to the patient over the phone. C. Tell the patient to wait for the provider's review. D. Ask the nurse to interpret the lab values. Answer C. Test results must be reviewed and interpreted by a provider before being released to the patient to ensure accuracy and appropriate communication. A patient calls to cancel a follow-up visit and requests to reschedule. What should the CMAA do first? A. Remove the patient from the schedule and call back later. B. Document the cancellation reason and offer the next available slot. C. Delete the entire patient chart. D. Refer the call to the physician. Answer B. The CMAA should properly document the cancellation reason for record keeping and offer the next available appointment time to maintain continuity of care. What is the appropriate action for the CMAA when a patient refuses to sign the acknowledgement of HIPAA privacy practices? A. Refuse to treat the patient. B. Document the refusal in the medical record. C. Allow access to the record anyway. D. Ignore the situation. Answer B. If a patient refuses to sign, the CMAA must document the refusal and the attempt to obtain the acknowledgement, maintaining HIPAA compliance. If a CMAA receives a request to release medical records to another provider, which of the following is required before doing so? A. A verbal request from the patient. B. A written release authorization signed by the patient. C. Permission from the insurance company. D. Notification to the office manager. Answer B. HIPAA mandates that patient information may only be released with a signed authorization form, ensuring confidentiality and legal compliance. Which of the following forms must a CMAA ensure is signed before performing any surgical procedure? A. Living will. B. Financial hardship form. C. Informed consent form. D. Medical release authorization. Answer C. An informed consent form ensures that the patient understands the procedure, risks, and benefits before proceeding with surgery. When updating a patient's demographic record, which of the following data elements must be verified? A. Current medications. B. Family history. C. Emergency contact and address. D. Physician's credentials. Answer C. Demographic information includes address, phone number, and emergency contact. These must be accurate for communication and safety. A patient is upset about a long wait and begins yelling at the front desk. What is the best response by the CMAA? A. Ignore the behavior. B. Ask the patient to leave. C. Calmly apologize and offer an estimated wait time. D. Yell back to assert control. Answer C. Professionalism requires the CMAA to de-escalate the situation by calmly acknowledging the delay and providing a realistic time estimate. A CMAA schedules a diagnostic test for a patient at an outside facility. What is the most important piece of information to provide the patient? A. Parking instructions. B. Facility's hours of operation. C. Test preparation instructions. D. Facility's fax number. Answer C. Preparation instructions directly impact the accuracy and success of the test. The CMAA must ensure patients understand how to prepare. What is the most appropriate step for the CMAA when correcting an error in a patient's electronic medical record? A. Use correction fluid. B. Delete and re-enter the information. C. Strike through the error and make a dated note with initials. D. Leave it uncorrected. Answer: C. Medical records must retain original entries. The CMAA must line through, annotate the correction with date and initials, preserving audit trails. Which of the following actions should a CMAA take when a claim is denied due to incorrect coding? A. Submit the claim again without changes. B. Forward the denial to the patient. C. Correct the error and resubmit the claim. D. Discard the claim. Answer: C. Claims must be corrected and resubmitted to avoid delays in payment. The CMAA should ensure codes are verified before resending. A patient requests access to their complete medical record. How should the CMAA respond? A. Deny the request. B. Give the patient verbal summaries only. C. Comply with the request after written authorization and identity verification. D. Allow only provider access. Answer: C. Patients have the right to access their medical records upon written request and identity confirmation, as outlined by HIPAA. What is the primary function of a tickler file in the front office of a medical practice? A. To record patient copayments. B. To store old prescriptions. C. To track future tasks or appointments. D. To maintain staff schedules. Answer: C. A tickler file is a chronological reminder system used by CMAAs to manage follow-up tasks, patient recalls, or upcoming deadlines. What is the first step a CMAA should take when checking in a new patient? A. Collect payment. B. Verify demographic and insurance information. C. Ask about their medical history. D. Schedule a follow-up visit. Answer: B. Accurate demographic and insurance information is critical for proper billing and patient identification at the time of check-in. Which of the following phone calls should be routed directly to the provider without screening? A. Pharmacy calling to refill a prescription. B. Patient calling with flu-like symptoms. C. A call from another provider about a mutual patient. D. Medical supply vendor. Answer: C. Communication from another healthcare provider regarding a shared patient should be directly routed to ensure timely and accurate collaboration. A CMAA observes a coworker accessing a patient record without justification. What action should the CMAA take? A. Report the incident to a supervisor. B. Ignore the situation. C. Confront the coworker immediately. D. Delete the access log. Answer: A. Any suspected HIPAA violations should be reported to a supervisor to ensure proper investigation and protect patient confidentiality. A CMAA schedules a patient for an outpatient procedure. What document is essential for the patient to bring to the appointment? A. Copy of the office policy. B. Hospital newsletter. C. Insurance authorization or referral. D. Job application. Answer: C. Many outpatient procedures require prior authorization or a referral form. The CMAA must ensure the patient brings this to avoid delays. Which of the following is an acceptable way for a CMAA to maintain a clean reception area? A. Cleaning only when visibly dirty. B. Wiping surfaces once a week. C. Disinfecting daily and ensuring no clutter. D. Relying on patients to clean up after themselves. Answer: C. Cleanliness impacts infection control and patient satisfaction. Regular cleaning routines help prevent disease transmission and maintain professionalism. When should a CMAA collect co-payments from patients? A. After billing the insurance. B. During the check-in process. C. At the time of follow-up. D. After the medical chart is completed. Answer: B. Co-pays are due at the time of service and should be collected at check-in to reduce billing issues and ensure compliance with payer contracts. A CMAA needs to create a list of patients who have overdue preventive exams. Which tool should they use in the EHR? A. Insurance Summary Report. B. Financial Ledger. C. Patient Recall or Query Feature. D. Accounts Receivable. Answer: C. The Patient Recall System or Query Feature allows the CMAA to generate lists based on criteria like overdue preventive services. What should a CMAA do if a patient arrives at the clinic without an appointment and insists on seeing the provider immediately? A. Tell the patient to leave. B. Fit them into the schedule without notifying the provider. C. Inform the provider and follow office policy on walk-ins. D. Ask the patient to come back another day. Answer: C. Walk-ins should be handled based on provider availability and clinic policy. The CMAA must inform the provider and manage expectations. When preparing a claim for submission, the CMAA notices that the diagnosis code and procedure code do not match. What should be done? A. Submit the claim anyway. B. Call the patient to verify diagnosis. C. Contact the provider for clarification. D. Delete the procedure code. Answer: C. Mismatched codes can cause denials. The CMAA must clarify with the provider to ensure accurate coding and proper claim submission.